Hello, I'm Mako, and let me ask you guys the questions. Have you guys have a abdomen X-ray before, and how was your experience? All right, thank you for your answer. Let me talk to you guys about my case study analysis. For my introduction, an KUB abdomen was ordered on September 9, 2017. The patient is a 9 years old female. She had no history of allergy, no previous surgery. She has a previous history of UTI, urinary incontinence, and unspecified constipation. According to the patient foster mom, it's been going on for over a year. She takes one Miralax packet a day and only defecate once a week. For her signs and symptoms, her belly gets bigger, no vomiting. Even though she hasn't defecated in a while, she still eats normally. Her foster moms give her castor oil, Dulcolax, X-Lax to help her defecate, but it did not help her at all. She experienced a long period of time between bowel movements. The real reason why we're doing this test is because of the evaluation of SIDS marker ring study while taking the Miralax for her motility. For this test, they make her drink some marker rings, and it's just like tiny rings, and she's actually gonna drink it, and it will see on her colon at all for radiographs. And her diagnosis was constipation, fecal impression, and abdominal distensions. For the procedure and projection, I will tell you guys about it. And the requisition was printed automatically in workstation. It was stated that the patient is in the lobby, so I went in there. It was on the PIC Diagnostic Children Medical Center, and I called the patient name, I introduced myself, I checked the armband, and took them to the x-ray room. I used the hand sanitizer before touching the patient, asked them for verification, name and date of birth, and I asked the mom if there's chance of pregnancy, and she said no. I explained to both of them what's gonna happen, and I told her daughter that we're gonna take one picture of her stomach. I lowered down the table for her. I made sure the tube is out of the way. Since she was wearing jeans, I told her to lower down, and I give her some cover sheets so she could have her privacy. I positioned her for an abdomen KUB and make my exposure. The SID I used was 43 inches, and I used a grid because the anatomy was greater than 10 centimeter. I used 72 kbp at 25.2 mass, and I used the EEC to know my mass, and I instructed her with expiration breathing instructions, and I didn't use any shield because it could obstruct the patient anatomy. For my image criteria, according to Martinson, the following image analysis guideline demonstrates an optimal abdominal KUB projection is the spinous process are aligned in the midline, and the pedicles right here have an equal distance. The iliac wings right here actually are symmetrical, and the sacrum is supposed to be in the middle of the pelvis, and it's aligned to the pubic symphysis right here. The fourth vertebrae, lumbar vertebrae, needs to be in the center of the exposure field as well. According to Bontrager, the following factors play a big role in creating an optimal abdomen KUB projections. There's a minimum of 40 SID, shorter exposure possible, especially with children and infants. You want to watch their breathing patterns, and you have to use grid if it's 10 centimeter or larger. Gonadal shieldings on all boys, and for girls it's very rare to get them to a gonadal shieldings because it could obstruct the anatomy. For my image analysis, according to Martinson and Bontrager, the collimation on the lateral should be 0.5 skin line, but in my picture I did not collimate at all, and the minimum SID is 40 inches, and I've used 43 inches for mine. The iliac wings is actually not symmetrical, so there's a rotation. The fourth vertebrae is supposed to be in the middle, and in my case it's actually the first lumbar vertebrae. You're supposed to include the diaphragm, and I included more than enough, so you could see some T-spine right here. And for my technical factors, first I used a 72 kVp at 25.2 mass, and I should have lowered down my mass. I used the AEC, and it gives me that mass, and I should have lowered it down to decrease my patient exposure. Even though my image is acceptable, it is still considered suboptimal because it did not meet the required criteria for it. And as seen in my radiograph, there's no external or internal artifacts such as jewelry, body piercings, or pacemaker. For this kind of projection, the common artifacts for this one is actually the jeans that they're wearing. So you should lower it down because, you know, sometimes the zipper will show up. And actually they have different kind of body piercing, like belly button piercing is very common even with children as well. So to ask them nicely to remove it, sometimes it's very hard for them to remove it, and it's a lot harder for them to put it back. And for the radiology impression, I'm going to explain about that one. There's actually a few skid markers remaining in the abdomens. One of them are actually in the descending column right there, and right here in the rectum there's a lot of markers in here. And actually there's like a remarkable gas patterns in her bowel, and but there's no dilated kind of airfield on it, so that's a good thing. There's a large stool burden, and her muscle is very stable, so she could, you know, she could walk, she could, you know, she's not very weak, she's still very active. And there's no calcification, clinical calcification whatsoever, and no free air at all. So you could see in the stomach that there's no free air because there's no dark spot in here. And for my last one, I'm gonna go ahead and name 10 anatomy, and I'm gonna get it closer. So this is the right diaphragm. This is the 11th thoracic vertebrae. That is the first lumbar, and that's going to be the spinous process. That is the 12 ribs right there. And I'm going to go down with my computers. That's going to be the iliac crest, the ASIS. And let me go down some more. The sacroiliac joint. This big thing right here, the sacrum. And the last one right here, it's going to be the femoral head. And that's about it. Thank you.